Osgood-Schlatter's disease. It's one of the most common knee issues in active teenagers. Now, whether that's from running, football, gymnastics, or any other high impact sport, knee pain can be frustrating, and if it's unchecked, it can lead to long-term problems. So here at Sports Physio UK, we see this all the time, especially in your young athletes who are training hard and pushing their limits. I'm Scott Woodhead, Senior Sports Therapist and Co-Director here at Sports Physio UK, and we work closely with your amateur sports clubs, including the pre-mentioned already in another video, the Oldham and Rochdale Harriers. We're helping those young athletes stay injury-free and performing at their best. Now, stick with me to the end of the video, because at the end, I'll be giving you some key exercises and some tips to help reduce the risk of Osgood-Schlatter's and keep that knee pain at bay. So what is it? Why has it happened? Let's have a look. This is a patient that never left. Osgood-Schlatter's disease is when this tendon here connects over the kneecap and then it connects to the shin bone. Quite straightforward. And it becomes irritated at this point due to repetitive stress. Now, it's most common during the growth spurts, which is when that bone above and below, it grows faster than the muscle. The tendons just can't keep up. Now that imbalance causes inflammation and pain, and it hits just below the bone. Now, an important point here, the patellar tendon itself stays really strong, but it's the attachment of the growth plate just below the knee, all right, that becomes separated and becomes irritable and inflamed. So as the body tries to heal, extra bone can grow underneath. That's what we call in the medical world sort of ossification. And that might lead to that noticeable bump that you might see on your child's front of the knee as they're growing up. And it can be tender to touch. That condition tends to happen at different ages for boys and girls. So girls typically hit their growth spurts between sort of 10 and 14, whereas the boys go through them a little bit later on between 12 and 16. So let's just have a look at the main reasons very quickly why the younger athletes are developing this specific condition. So obviously, as we've already mentioned, number one, our growth spurts. That's when the bone grows quickly, the muscles and tendons become tight, pulling on that knee just underneath the kneecap. Repetitive impact. The sports where we're running, we're jumping, quick directional changes, putting extra stress and power on that knee, that impact. And also tight quads linked to sort of the tendons being tight. But if the thigh muscles are too tight as well, they're going to pull harder on that tendon that goes over the kneecap. Stretching is missed so many times in the sporting settings these days. Stretching is paramount in situations like this. But also we look at a whole body approach. So weak glutes and hamstrings. If the muscle at the back of the leg isn't strong enough, the front of the knee and the front of the thigh has to take that extra strain. Is there any good news? I'm not sure, but the good news, there are simple ways that you can reduce that risk and keep your knee strong. So let's just go through very quickly 3 key exercises to help your knees stay strong and pain-free. Number 1, your quad and hip flexor stretch. So these are in the front of your thigh and on the front. So if we kneel on one knee, like you're proposing, on a cushion to support your knee, with your back foot resting onto a chair, you can then lean forwards into that proposal stretch and feel the stretch on the front of the thigh. Now we want to hold our stretches for 30 seconds and then switch legs. Do it on both legs. This reduces the tension on the kneecap sort of tendon, so that tendon that goes over the knee. Number 2, we want some strength. So glute bridges. Now lie on your back, knees bent and your feet flat. Lift your hips up, squeeze them glutes and then lower it down. So repeat that for 15 seconds. 15 reps, but hold it up only for a couple of seconds. This will strengthen the hamstrings and the glutes, reducing the stress on the knees. So remember what we were saying before. Number 3, step downs. These are really, really easy. You could do these anywhere. So stand on a step, even at the bottom of your stairs, and slowly just step one foot down, keeping the control but being very, very slow. And then push back up with your back leg. And then step back down and then push back up with your supporting leg. This improves your knee stability and helps absorb the impact during your sports. These exercises only take a few minutes a day. They can make a huge difference in reducing your knee pain and keeping your younger athletes active. I can hear you shouting, what's next? If you're struggling with that knee pain or your child's knee pain, Sports Physio UK is here to help. Our expert team, we work with young athletes across all the sports and the non-sporting world to keep them performing at the best and pain-free. So click that button at the top of our webpage on the top right, or have a look at the bottom of our Facebook and Instagram post, and you'll be able to click the post to schedule an appointment today. We can help. Don't take our word for it. Check out the amazing reviews. They're all on Google. See how we've helped others. But we'll see you soon here at Sports Physio UK.